Breast augmentations aren't only for women who want a larger chest. These can also be used to recreate a woman's bust after undergoing a mastectomy. Today we'll follow Marlene's journey as she has a reconstructive breast augmentation here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Losing your breast can be a very emotional time for any woman. That's why I've decided to dedicate this show to reconstructive breast augmentations. Later on in the episode, we'll meet Marlene, who had to have this particular surgery. But first, let's talk to her cosmetic surgeon, Dr. Barson. Dr. Barson, how are you?
I'm great, thank you.
Okay, we normally think when we hear mastectomy for women who have had breast cancer.
Yes.
Now, this particular procedure was a complication from breast implants when she had an infection from them. Is that correct?
That's correct, yes.
Okay, so talk us through Marlene's journey. She had them done at a first implant at 20, I believe.
Yes, and then they were removed with another procedure and another implant, but got infected, fairly severe infection for a period of time. Implants had to be removed again, and this left basically just a skin envelope with a lot of scar tissue.
Is this a common thing that happens out there with breast implants?
Well, you know, I can't tell you exactly how common it is, but we do see women with this. In fact, I just saw a woman last week.
Who has come in to actually have reconstructive surgery because
Yes.
of complications of her breast implants. What is the particular reasons why you would have an infection from an implant?
Sometimes, and a lot of times, an implant will form what's called a biofilm on the surface of the plastic, that the envelope of the implant. And sometimes if that gets disrupted or from some other thing, it can infect the rest of the tissue. Now there are other causes also. Sometimes people have hidden infections within their body, and stress or an injury or something like that can activate it and cause it to happen. Sometimes it's just a consequence of the surgery itself.
Okay, talk us through the corrective breast augmentation procedure. What's the procedure?
In Marlene's case, she had an awful lot of scar tissue, so there's a lot of deformity in the remaining skin. And the first thing we had to do was to free up all that scar tissue.
Okay.
So that the skin envelope itself was much more even. And then we went about the placement of the fat to reinflate the breast.
Okay, because when I think about having a breast augmentation and having an implant put back in, not liposuction on the stomach and then placed into the breast.
But most of the women, if they have an implant go bad, will just use another implant.
Yeah, that's why I find this quite interesting, that she chose not to have another implant.
Well, some women get sort of discouraged with implants if they have repeated problems, and we do see women like that.
A regular augmentation would probably be you deciding you either want to go larger or smaller. That's up to you. And a corrective one would be if you had breast cancer, then you would have to have a corrective augmentation.
One of my friends had her breast removed because of cancer. She's going through the corrective procedure right now, and she's really happy with it. I think if you're correcting a problem like cancer or, I don't know, maybe a defect, that's great, but boy, think about that one. I say don't do it and just feel comfortable with your own body.
Dr. Barson, you're known for natural breast augmentations.
Yes.
Okay. Why do you feel that this is a great procedure for someone who is having augmentation work done, reconstructive work, instead of an implant? What's the benefits here?
The first benefit is it's natural. There's a lot of women that we see that just don't want something foreign inside of them. The second reason is a lot of times they've known someone that had reconstruction and they either didn't like the look, or they had complications and just didn't want to go through that.
I can only imagine by using your own fat from your body, the breast is going to feel a lot more natural.
Well, it feels totally natural because your breast is primarily just fat.
How long after a woman has a mastectomy can you actually have breast reconstructive surgery?
We usually like to wait at least 3 months and preferably 6 months so that most of the healing has taken place and everything is in a stable condition.
So Marlene had an infection from the breast implant. Is there any risk of her getting an infection from having the natural breast augmentation work
Well,
done?
there could always be a problem with that. If there's a little nest or a little few cells that have survived in some scar tissue or something like that, it could be activated by any procedure. So there is always a very small but a definable risk of that possibly happening again.
Will Dr. Barson be able to help Marlene? I really hope so. After the break, we'll chat about what a natural breast augmentation actually is and then watch as Dr. Barson performs it right here at the Younger You. Do you want to take your hair to the next level? Well, it's time for another giveaway here on the Younger You. Enter for your chance to win a whole pack of GHD styling tools valued at over $861. Head over to youngeryou.tv/contest to enter. The following footage contains surgical procedures. It may be too graphic for some viewers. Marlene is about to get her reconstructive surgery, but first, let's hear from Dr. Barson about this particular procedure. Would you be asking for a particular size when you're actually having the natural breast procedure done? So do you say, look, I want a D size or I want a C size, or it's just how much you harvest at the time?
That's a good question, and it's there's two things about it. The thing that determines the breast size and the breast shape are the internal ligaments within the breast, Cooper's ligaments, and also the skin envelope. Now with an implant, you pick a size, you pick a shape, and then you make a pocket and you put it in. With this, it's a little different. It's sort of like, in the old days, they used to airbrush pictures, and they would use a little airbrush to a little here, a little there, until they got the picture the way they wanted it.
Yeah.
In this case, what we're doing is we're doing sort of the same thing. We put the bulk of the fat in, and then we sort of airbrush, if you will, putting a little fat here, a little fat there, until it looks like we want it to.
And I would assume by doing that it's not major recovery time.
No, most people are fully functional the next day. They might be a little sore, but really the thing that is most problematic is the place you take the fat from, because the liposuction site will be more tender because it's a little more trauma to the tissue.
And because we are using our own fat, I know this is probably a silly question, but are the fat cells better from the stomach or from the hip or from the inside of the thigh? Are they more sturdy fat cells?
Yes, well, most women will tell you that all fat cells are sturdy. None of them want to go away.
But in all seriousness.
We've taken fat from pretty much every body part and put it in the breast, and we really don't see a whole lot of difference. But we do tell women, some women have what you would call diet-resistant fat. They say, I can diet, I can work out, and this goes away and this goes away, but this doesn't go away.
Yeah.
And so if they have an area that's more diet-resistant, that's the area that we want to take, because the fat, when it's transferred, doesn't know it's moved.
Right.
It still thinks it's in its original location. And so if it's diet-resistant there, it'll be diet-resistant where we put it.
Perfect.
Yes.
Because we all know with the natural breast augmentation, it can decrease and increase with weight loss or weight gain.
That is
so
true.
1 month you could have slightly larger breasts and the next slightly smaller.
Yes, once the fat cells have reconnected with the circulatory system, the blood vessels, once they've done that, then they behave as fat anywhere. They're just fat again. They're not special fat, or they're not unusual fat, they're just normal fat. That's all I'm saying.
Thank you, Dr. Barson. Now that we've talked to Dr. Barson, let's head over to his office to watch him help Marlene get back her breasts.
My name's Marlene Cole. I'm 64 years old. I'm so excited to have this done. I feel like a kid waiting for Christmas. I do. I want to feel pretty again.
What we're doing is we're going to be using something called tumescent anesthesia for this procedure. This is where we use kind of a local numbing without general anesthesia. The advantages to this are that it's safer, it's cheaper, you have less bruising, pain, swelling, and downtime. It takes a little time to do, and so we do spend some time. Typically it doesn't hurt a lot because fat has actually very few nerves in it, as it turns out.
I had implants put in when right after my children were born, my first children. I was in my early 20s. And as I got older, into 40s and 50s, and when I was in my 60s, I was starting to feel like a tank ship. And I was getting craters in my shoulders and hunched over, and so it's not like I was gaining a ton of weight or anything like that. Yeah, I was gaining some, but not enough to compare to how much my breasts were growing.
Sometimes the tissue's a little tougher, especially if somebody's already had liposuction before. So when you go back through those areas, it's more tough, more dense, I guess. It's actually kind of nice to have sleepy but awake, because they're able to get into positions that would be very difficult if it was under general anesthesia.
So my husband and I talked about it, and I thought, let's just go remove my implants. Well, naturally, lo and behold, we went to the wrong doctor, and I came out of surgery and I felt fine about a month later, because I'd never gone in to see him, because you go except for taking the stitches out. I showed them to my daughter, and she looked at me and she about come unglued. She says, "Mom, you've got infection." I mean, the infection was growing up my neck. It was just all over. And they put me in for some emergency surgery, and they did a debridement, and they just took everything out, just everything. They just emptied me. I wanted to feel pretty again after it was all said and done, because I was not pretty. I would hide from the man I love most. I had a hard time letting him touch me, you might say. No, I don't know if he wanted to, but I didn't care because I was so ashamed. And so I've decided to try and do something about it so I can feel good again. I just want to feel good about myself.
Coming up in just a few minutes, we'll continue to watch Dr. Barson's perform Marlene's corrective breast augmentation. Do you want to take your hair to the next level? Well, it's time for another giveaway here on The Younger You. Enter for your chance to win a whole pack of GHD styling tools valued at over $861. Head over to youngeryou.tv/contest to enter. The following footage contains surgical procedures. It may be too graphic for some viewers. There are so many different types of surgery a woman can choose to get an ideal chest. Marlene chose to get a natural breast augmentation. Let's hear why, as we watch Dr. Barson finish her surgery.
I know I'm a woman. I don't feel like I'm not. I just don't feel like a pretty one.
We're going to use another tool here. What these do is they smooth the fat. The commonest name is Becker grater. They're not really very aggressive. But what it does is, see, some fat will form into little pockets, and sometimes they're hard to get out just by conventional liposuction. So what this does, it goes along and busts them up, and then we'll take just a little more liposuction, take out that was busted up.
I feel a tube going in me, but there's no personal pain. It's all numb. And
the reason she can feel it is because, you see, the belly wall underneath is not numb. And so when something moves over it, you can actually feel it. But the part where this is, she can't feel.
I kind of like being awake, though.
It is nice, isn't it?
I just feel like I want to hide. Even at the shop, I catch myself, I see somebody come in, oh, wow, wouldn't it be nice? And that can be me again.
Carefully stand up.
Stand up?
Uh-huh. But hold on to the table a little bit. Okay. So we've got to do some more right there. A little bit right there. This is where we use a laser to tighten the skin. You have to do this under the skin or it would burn it. If you did this on top, it would be sort of dangerous. But underneath, the skin will tolerate a lot of heat, and it's heat that actually makes the skin shrink or tighten up. And it's one of the things we do on the belly that works quite effectively.
I don't want to stay incognito for the rest of my life, because I'm only 64 and I got a lot of youthful years ahead of me. I got libido left. I got needs, wants, desire. Just because I'm older, my life doesn't shut off.
She has scarred down areas here that's, if I go like that, you can actually see that it pulls a scar down. It's attached to it. And so what we're going to do, this is what we do sometimes, we'll go under there and separate the scar so that it can bounce up, and then you won't have that valley. She has some scar tissue, both from previous surgeries and from infections, that has bound down and tied her skin down to the deeper tissue. And so what we're doing is we're trying to release that. If we just put the fat in with the scar bound down like that, the fat would not, it can't break the scar or anything, so the scar would still hold the skin down in that area. And now we've released the scar tissue that's bound down the skin for the most part, and now we're putting in hundreds of little threads of fat to kind of fill out the empty part.
And my husband is handsome. I mean, he'd turn ahead in the crowd in a heartbeat, and I love being seen with him. Well, I want him to love being seen with me.
The idea of how much to put in, you have to kind of decide beforehand. It's a little hard to tell during the procedure exactly if that's going to be, the amount that you want. So you have to kind of do it beforehand and have an idea before you even start the procedure. And we decided we wanted to have about 200 cc's more into this breast. So that's what we're shooting for today.
I would read self-help books. I would pick up all kinds of articles that would keep me in a straight happy mood, because I felt myself going downhill all the time. I don't want that. I don't mind growing old, but you know what? I'm going to fight it every step of the way.
This one still needs some more up in here. And actually maybe a little here, but this one definitely needs more here. Okay, go ahead and put it back down. And let's continue on.
I'm doing this for me, so I can feel good about me, and there's nothing wrong with that.
Marlene wasn't happy with her original implants. Will she be satisfied now with her new bosom? We'll find out after the break. Like us on Facebook and follow us on Twitter for updates on the show and how to join the Younger You conversation. Looking for the perfect beauty product? Each week, The Younger You highlights a standout product in the health and beauty industry. Head over to theyoungeryou.tv and check it out. Love to hear your comments. We learned all about natural breast augmentation, heard why Marlene chose this particular surgery. We also watched Dr. Barson cut, inject and stitch. Now it's time to get back into the studio for the final reveal. At 20. You had your implants done, your first lot of
I was
implants.
in my 20s.
In your 20s. Why so young?
I was young and foolish, and I just had 2 children, and I felt like I wanted my breasts back. And then later in years, I just became huge, big. So I was in my 60s and I wanted them reduced. So I went in to have a breast reduction, removed my implants, and a month later I was in the hospital filled with all kinds of infection.
From the second procedure?
From the second procedure, yes.
Okay. What type of infections?
I had all kinds of infection in the 7 months I was being treated.
Wow.
They put a pump on me because I went into the hospital and they took out my breasts and they hooked a wound pump to me. For 3 days I was in the hospital with an antibiotic drip. When I was released from the hospital, I had to go into the wound care clinic. I was in there 3 days a week for 7 months.
Lord.
I went through...
Why were your breasts getting bigger over the years?
Age, I guess.
Okay. Dr. Barson, is that because of the fat that is around the implant? The natural breast tissue that is increasing the breast size?
You know, there are a subset of women that over time their breasts do just get larger. We've known women that have had several breast reductions, not just one, but have a reduction, and 4 or 5 years later they have to have another one.
Okay.
They just keep growing.
Yeah.
And whether there's an implant or there is kind of doesn't really matter. They're just going to keep growing.
And I could also imagine they're growing because it's natural, but you've also got an implant in there.
Yeah.
So they're also twice as heavy.
Yeah, and my mother had it done too, a breast reduction.
Okay. When you did that, did you ever have any idea that you would be going through the next lot of hell?
Not even, not in a heartbeat.
There shouldn't be. If a woman has self-esteem, there should not be. Now, I've had friends that have had that, and yes, you will go through a time period where you feel you're not as attractive, but once they get past that and they understand that they can feel just as beautiful with or without, that tells me they have better self-esteem.
I honestly do not think so. I think that if you want to do that sort of thing, go for it. That's what I say.
How do you feel?
Better.
Do you?
Much better. I mean, it got to the point where I was hiding from my husband. I would turn away from myself in the mirror, and you become depressed. I don't care how old you are, you want to feel good about yourself.
Do you hear that a lot, Dr. Barson?
A lot of women are not happy with their bodies for one reason or another. Sometimes it's just the way they are. Sometimes it's the consequences of procedure or some other choice they've made in life. But there's an awful lot of women that are not very happy with themselves.
Dr. Barson, I'm sitting here listening to this story, and I forget for a moment that you're a doctor coming on my show talking about natural breast augmentation. What I think is you've just changed her life. And I don't see that as being a doctor. I see that as someone who is skilled at what they do, and you've given Marlene a new outlook on her own life. Do you feel that he did give you a new...
Yeah, because I wasn't going to go with implants. I refused to. And then I would see these billboards around town, natural augmentation. Well, I looked into it, and I decided I'm going to go talk to him and find out. And I liked him, and he was great, and I thought, you know what, I'm going to go with it. It's my life. I got a lot of years left.
Dr. Barson, we were just talking about the infection that could have gone into the bloodstream. How serious would that have become if that had happened?
You know, people die from that. In fact, this was just in the news recently about sepsis, and they did a large study of all the hospitals in the United States and found out that sepsis was a far, far greater problem than they ever realized before.
Well, I think what's nice about this story is that it wasn't about having breast augmentation because you were vain and you wanted bigger breasts and...
Well, what's wrong with a little vanity?
Listen, I've got a whole show about it. Trust me, that's what I do.
Yeah.
But this is a beautiful story. And I just think that when you were given no other alternative, what was the best way to do that? And Dr. Barson, thank you so much for showing us at home what was possible and not having to have an implant. And Marlene, I think you did a great job and a great choice. And I'm sorry you had to go through so much pain earlier on. I think Marlene is the perfect example of how cosmetic surgery can make you feel happier and obviously more confident, like in Marlene's case. It not only alters your physical appearance, it can also improve your emotional well-being. For more information about the show, please visit our website at theyoungeryou.tv, and I'll see you next week. Next week on The Younger You, we will learn all about your teeth, how to keep them healthy, and as always, ways to keep them looking pearly white. The Younger You set provided by Madison Recording Interiors.